Welcome to another empowering episode of Empowerment in Illness. I am your host, Gwen. And today, we're diving into the holistic and integrative approach to managing chronic conditions with a very special guest, Dr. Darla Booth. Dr. Booth is a certified functional medicine clinician at Brain and Body Health and brings a wealth of knowledge in helping patients tackle chronic illnesses with a whole body approach. This is her first time joining us, and I couldn't be more excited to explore how functional medicine bridges the gap between traditional healthcare and a more comprehensive look at wellness. So let's get started and discover how functional medicine can empower you on your health journey. Dr. Booth, welcome to the show.
Thank you so much. So happy to be here.
So can you give us a little bit about your background and what inspired you to pursue a career in functional medicine?
So about 25 years ago, I had a baby and I had so much fatigue and I just wasn't really recovering from that delivery that well. And I was trying to figure out how in the world am I supposed to figure out how to feel better? And I'm a healthcare practitioner, I'm a chiropractor, I'm a functional medicine practitioner. I decided I needed to start diving into training all around like lab work because I thought a lot of my peers were saying, take this supplement, take that supplement. I hear it's good for energy. And I really wanted to find out what the root cause was and why I wasn't feeling well. And so I just thought that the best strategy would be to learn about blood work and learn how to fix blood work and make people come into optimal ranges. And I also figured that lab work, blood work is a great language that all medical professionals speak. So it's a way that I could figure out how to speak and bridge a gap between me and, say, medical doctors or anybody else who is working on the patient. And it's been the most fruitful thing that I've ever done is trying to figure out how to solve people's health issues through blood work.
Okay, so for those who may not be familiar, can you explain the difference between functional medicine and traditional medical practices?
Traditional medicine does a lot of training on a lot of different things, right? There's a lot of specialties, and there's general physicians who just are generalists who know a lot of things. There's people that deliver babies, there's people that heal fractures and do surgeries and such. But in the traditional medical world, they do a lot of really great stuff to save our lives. And they do a lot of great stuff about doing surgeries and taking out our gallbladders and, helping us with heart attacks and things like that. But there's a gap in the knowledge of the people that go to medical school that they don't quite know much about how to optimize health. And how do we make someone that doesn't feel great better? What does that look like? And then functional medicine has a little bit different approach. They're looking at things like, we're going to narrow in lab ranges and make sure that they're actually optimal, not just on the edge of disease. And that's kind of where functional medicine lives, is how do we keep people more in optimal ranges versus just not diseased? So that's, I think, the difference. There's a lot of different training programs that have functional medicine approaches. So it's not standardized to just one program. There's about a dozen of them. And all of them teach a lot of similar things. And it mostly focuses around blood work and microbiome testing and maybe food intolerances and some things that maybe traditional medicine might not consider is the most important because they haven't really had a lot of training on it. So it's kind of a bit of a field that it's an abyss of information that I think that we all can dig into. It's a lot of unknowns, right? It's a lot of just trying to figure out like what makes sense and how does somebody feel better, right?
Absolutely. That's one of the things that people with chronic illnesses suffer from when we go to a regular doctor, and I say regular doctor.
Yeah.
They tell us, oh, it's in your head. This test came back, it's normal.
Right.
But we are not feeling like it's normal. We're still sick, but we can't get any answers.
And it's so tricky because so many people are just being gaslit by their doctors just because, and I don't even know that the doctors are really meaning to do that. They're really putting all the information that they know toward this patient, and when things come up normal, they don't know what else to do next. I find that it's really interesting. I've been doing this for 27 years, and the relationships that I've made with people in my community that are medical doctors, that are orthopedists, that are physiatrists, that are all sorts of different traditional OBGYNs, they'll refer to me because they'll say, I don't know, but I bet Darla probably knows. Mm-hmm. And so they know that I'll run more extensive lab work than the traditional lab work. The tricky part when I talk to my medical doctor friends is that they say, we actually don't know. And it's tricky because the patients are expecting us to know alternative medicine, functional medicine, and traditional medicine, right? It's a whole different type of field. And they don't necessarily want to run these lab panels because if they come up positive, they're not really sure what to do with it.
Okay.
So I feel for both sides. It's a tricky place to be because I think we are expecting too much out of our traditional medical doctors. I think this needs to be a specialty.
I agree, I guess, because when I go to a doctor, I am expecting him to know he has a PhD. I don't have a PhD. Mm-hmm. And I'm putting my trust in him because I think he will fix it. He'll find the problem. You're doing the testing and you'll find what is actually wrong. But all I come back with is just medication. You're giving me more pills. What am I supposed to do?
Well, that's the tricky part. If we have more and more trained people that are trained in functional medicine, then I feel like as far as my community, I live in Santa Cruz, California, the doctors are relieved to give me the patients. I'd love to see medical doctors saying, you know what, I don't know, but here's somebody who might know. And I feel like that's the bridge that we need to create. And I think it's tricky because medical doctors, especially MDs, are trained very traditionally. Now, if you're an osteopath, you're a DO, you're trained a little bit differently than the MDs are. The DOs are coming at me saying, I know what you're talking about. I've learned some of this in my basic training. I don't know enough to trust myself to do it, but I know what you are talking about. It's an easier bridge with the DOs. So I'd say if you had a choice to choose between an MD or a DO, you might have a little bit more connection with a DO because they might have had, well, I don't know everything about it, but I did hear about this when I had my basic training.
Okay.
Possible.
That's something that we need because, like I said, when we go into the office, I'll use me for example. Before I was diagnosed, I was feeling tired all the time, and I started having more symptoms, rash, canker sores in my mouth, a fever. But the doctor that I was going to, he just ran tests, and that's all he did. And then he would give me a pill for that symptom. The more pills that I had, it started affecting the liver. I wasn't getting any better. I just kept getting worse. Now, I still didn't get a diagnosis from him. It's just that he didn't know what to do. He didn't question other doctors. He never sent me somewhere else to get a second opinion. He didn't say, I don't know what it is that you have. Let's put you in the hospital. I didn't get any of that.
And really, they go through their checklist. They have a lot of standards of care. The standards of care are supposed to be, you know, you look like you're having an appendicitis attack, and then you go through these procedures. When someone's coming in with these very vague, I don't know what they are, and they can't find something right away, I mean, your best course is going to be being sent to a rheumatologist. Now, a rheumatologist is going to say, well, here's your Plaquenil. Let's start there. And, you know, some people need to be on Plaquenil because they have joint damage. They have an aggressive process that's happening with their immune system. But when you take 20 steps back and look at the big picture of this patient, you really need to take a big picture approach for why it started. Are there genetic factors? What happened? How did this start? What was the trigger? You know, you almost need to have somebody who's just specializes in autoimmunity that's not a rheumatologist that really can look at other factors that can trigger autoimmunity. It's tricky.
It is, and I think we are the ones that are catching it because we don't know that. We don't know where to find functional medicine physicians. We go to the regular doctor.
Correct. Right. And this is why I've been pushing myself out onto social media a lot, because I am seeing this gap in knowledge and a gap in knowing an approach to try to, how do we look at this, right? How do we comprehensively look at this problem? Because I mean, I have so many people on social media that'll reach out and just say, just tell me what to do. God, I really wish I had a recipe for you. I really do. But like some people, it's because they have genetic predispositions. Some people, COVID triggered this. Some people have leaky gut. Some people don't. Some people have toxin exposure. Some people, like it's just so all over the board that you almost have to be this inspector to try to like sift and sort and figure. I also have to have people come in and say, this is complex, and it's like 10 necklaces that got tangled up in a big knot, and I just have to sift and sort and try to get it all untangled, and I hope I can untangle it. I hope it doesn't break, but I'm going to do my best. Every case is really different. Every case of lupus is very different. Every case of Hashimoto's is very different. There are some overlapping like Venn diagram things, but there's not a lot of recipes, which makes it so hard, right?
So what would be your approach for someone like me? I've had it forever.
Okay.
I have lupus, and I'm on medication, Plaquenil and Prednisone. I've been on it for years now.
Right.
They tell me I'm not supposed to be on it for that long, but I've tried methotrexate, Imuran, all of the other, Benlysta, nothing worked. Plaquenil and Prednisone is the cocktail that works for me.
Right. So the first thing I would think about is I usually approach food first, and I want to know what food you're eating, what food you're not eating. Do you find that there's a trigger? Do you not? A free way of doing this, of course, is to hop on an AIP diet, right? Where you're an autoimmune paleo diet, where you're off of a lot of things, right? You're pretty specifically just meat and some veggies and not nightshades and not nuts and seeds and no gluten, no dairy. Just trying to like do that for a few weeks and see, does that make a difference for me? Does that make me feel better? On that same topic, I can do a panel on someone through a company called Cyrex, and they're going to do a blood test to say what foods are reacting. And I'm going to be looking at kind of my top 25. Really, the top 5 are pretty much gluten, dairy, corn, soy, and eggs that tend to pop up on a lot of autoimmune people. And I'm going to be looking for leaky gut. Has this been going on long enough that your gut is inflamed enough that your gut barrier isn't as intact and solid as it should be? So that's a big area that I look at first, which is food. But I'm also going to run a really just wide blood panel and say, we're tossing out a big net. I want to see what kind of fish we catch.
Okay.
Now, is the vitamin D really low? And if vitamin D is low and they're taking vitamin D, how's their gallbladder doing? Because if the gallbladder is not breaking down fat, then all the fat-soluble vitamins might be low. The vitamin A, the vitamin D, the vitamin E, the vitamin K. So do I need to support the gallbladder to digest? Do I need to put them on bile salts and lipase when they eat their meals with the fatty meal, with their ADEK together to get their vitamin D up? That's important to get up. So that's another basket, many baskets. And then we go into, what are their symptoms? Like, what are your symptoms? Do you have bloating? Do you have reflux? Do you feel like you've had SIBO? How are you constipated? Do you feel like you have diarrhea? Do you have IBS, right? So is it an overgrowth of a bad bacteria? Maybe. What if we change your... And are you stressed? Right, exactly. What's your cortisol looking like? I mean, gosh, a lot of people that went through 9/11 that lived in New York City had such high cortisol that they had a leaky gut barrier from that created some long-term health issues. That was a really, really stressful high cortisol event. Do you have trauma? Do you have high cortisol? Does that run in your history? Do we need to work on managing cortisol? Now, another thing that's really interesting that I'm finding is that now that little blood sugar monitor is over the counter that's called Stello, I have a lot of my patients getting on this little Stello blood sugar monitor that you can just pop on the back of your arm. And all of us are shocked, even myself, at how many times our blood sugar spikes and how many times my blood sugar was crashing. Every time it spikes and crashes and spikes and crashes, that drives high insulin, it drives high blood sugar, it drives inflammation. Is that a piece of this puzzle that we're trying to put together. Sure, right? So I'm going off of symptoms, I'm going off of lab work, I'm going off of where should we start. And food is always the place we start. If I can get people to get off of gluten and dairy for a few weeks, just really, really, really strict, and then see how they feel. I'd say 80% of people go, I feel better when I don't eat gluten and dairy. That might be a trigger for me. Now, I have a patient I was just talking to before I talked to you who she eats nightshades, tomatoes and peppers, and she gets joint pain. So that's a trigger for her on top of gluten and dairy.
Oh, okay.
So, do you have joint pain? And what can we strip down someone's diet just to some really basics, just for a couple weeks? Maybe people just eat like some cruciferous veggies and some green beans and some squash and some basic things with some meat, and let the immune system kind of chill out, and then say, okay, I'm going to put in corn and see how I feel. Feel fine. Okay, great. Awesome. How about I put in some tomatoes? How do I feel? Oh my gosh, my joint pain's back. Tomatoes are out for now. Now I'm going to put in some nuts and seeds. How do I feel? Feel fine. Okay, amazing. So then you work into the beans. How does that make you feel? Right? That's a free food allergy panel. It's actually one of the most gold standard allergy panels you can do, is an autoimmune paleo diet, because you're stripping your immune system. You're just pulling everything out. You're just saying, okay, what foods do we know for sure are probably not going to trigger you, right?
Right.
And then just let your immune system calm down for a minute, right? Maybe it takes a couple of weeks. And then maybe you kind of reintroduce one thing at a time and say, ooh, this made me have brain fog. Ooh, this made me feel bloated. This gave me a headache. This made my joints hurt. I don't know. Like everybody has a little different symptom that they're tracking. If you have a symptom, amazing. Some people don't have symptoms. Some people just kind of go, I feel fine when I eat gluten. And then they come back with a brain scan 20 years later and they go, I have white matter in my brain. What's happening? And it could be from gluten. It's such an interesting thing. I created this whole program called an autoimmune reset because I've been so frustrated trying to manage patients and trying to remember all the things I need to teach them all along the way that I've made a curriculum. And my curriculum is 12 weeks. And it's like every single week we have a Zoom and we learn about a topic. And then we might learn about protein digestion and reflux and heartburn, right? And then we might learn about gluten and dairy and blah, blah, blah. And then we might learn about anti-inflammatory supplements and detox pathways and blah, 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 right? We're going to learn about plastics and chemicals and other things that could trigger you, but they're all in a 12-week program so I don't forget. Mm-hmm. And I pre-made all these videos, and then we talk on a Tuesday, and then we have a Q&A on a Friday. This is my beta program that I'm working through because I need to understand what everybody needs to know for their autoimmunity.
Yeah, and it's so complex.
It is, and it's like I'm working with somebody who has autoimmunity, and we are running our head against the wall because I can't figure out how to get their ANA markers to come down, and they walk in with a plastic water bottle. I just want to smack myself and say, why didn't I tell them to get off of plastic? Because microplastics can be a really big trigger with autoimmunity. BPAs can be a real trigger. I go to someone's house for dinner, and they're flaming all these candles that are smelling terrible, and they have Glade plugins in their house. And I'm going, you're creating air pollution for yourself every day, and you're sleeping in this. Maybe that's your trigger. I continue to kind of refine this sort of 12-week program so that I can try to hit all the things so that at the end of 12 weeks, I feel like I want to give them like a cap and gown with like a little diploma. Mm-hmm. I can manage my autoimmune disease now, right? Because it's just that many things. And it's actually it's a path in self-discovery. And I just want to try to be a guide and say, let me interpret this for you. Let me help you sort this out, and let me help you figure out you. Do you realize that you're being triggered by this or X, Y, or Z, right?
Right. The things that you just named, I do all of that. I have the plug-ins. I'm eating different foods. There's stress. So everything that you just named, I have those. And my rheumatologist, my general practitioner, no one has said anything about diet until the prednisone, when it gets to a certain level and I start to gain weight, that I need to change my diet. But no one said anything about you need to eat this or stay away from that.
Right. I get some patients who come in the last 3 or 4 years with Hashimoto's, and they'll say, well, my doctor said that they've heard that I should get off of gluten and I should take selenium. And you know what? They're right. But that's not all. They're hearing things. And I think that some of the medical doctors are also feeling a little bit impotent about this whole situation. Like, how come I can't help these people? And there's all these people. And maybe they're just making it up. Maybe these women just, I don't know what's wrong with them. You know, like there's almost like a blaming because I think they're frustrated.
Well, we're frustrated too.
But you know what? This medical doctor is supposed to say, listen, I went through all this education and I don't see why you have all these symptoms. And so maybe you're making it up. And it just is a little bit of self-preservation for them as well as I think what's happening, right? When you don't know, you have to blame someone, maybe just blame the patient. I mean, my favorite doctors will say, I don't know, but let's figure out who can help you.
That's what we want to hear. We don't want to hear that it's our fault. It's just in our head. There's a lady that I did an episode with, and she had H. pylori. Mm-hmm. It turned into stage 4 cancer.
Holy moly.
She knew something was wrong, but they're telling her, oh, you can't eat spicy foods. Oh, okay. It's your age.
Right.
So you're gaslighting us, and we are still feeling, I know something is wrong.
Right. And the tricky part is that the doctor has 10 minutes to try to sort out all the things. And I'm telling you, I can't take a proper history in 10 minutes. I can barely take a proper history in an hour. So there's so much limited time, which is the trickiest part for the medical doctor, too, is that they don't have the time to find out. They just want to go, here, take some Zantac and go on. Take some Prevacid. Let's move on. I don't have time for this. I don't know. I'm fact, and I'm backed up. So I think they're just as frustrated as the patient. And so I just feel like there's such a window of opportunity for people to get trained in functional medicine and take the time and do the investigation and try to sort it out, because every single one of these things that I'm mentioning to you has white papers associated with that shows that it does trigger autoimmunity. The gluten, the dairy, the plastics, I mean, the toxins, the flame retardants, all of this has a lot of white papers and a lot of science that backs it up. But who has time to sort through all these white papers and sort this out and make a plan? And that's what I'm trying to do, is make a plan for people to go through a structured program. And I have it going on with me right now as your guide. I'd like to set it up so that there is a self-paced program, and that's what I'm working on, so that it's just really inexpensive for anybody to take, to say, here is your top 10 things you have to know. And then anybody can take it from anywhere. So there's such a gap in knowledge, but the information is there. It's just not made it into the traditional medical community. So it's not like this stuff is airy-fairy and we're making it up, because we're not. But it's also, who has the time to put it together?
Yes, but what about us, the patient? We don't have the white papers. We don't have the degrees.
And so my big thing is, how do I get this out to people, right? So, I mean, I'm on TikTok because I'm just making videos going, listen, you guys, here's what's happening. And I don't know, my daughter who's 25 bullied me into starting TikTok. And I'm like, now I'm on TikTok every single night answering 100 people's questions, which is great. But also, it's like, wow, I have a whole job too where I actually see patients in person, which is great. So I'm trying to do Zooms. So it's all new for me. I'm trying to figure this out. How do I incorporate all this, and how do I scale this in a way that I can teach so many people, because so many people need to know this information and get it to people without also breaking their bank, right?
Yeah, that's why I started the podcast. Like I said, I've been dealing with lupus for so long, and I've been frustrated, but I'm thinking about the new person. What about the person that was just diagnosed? How can I help them? Because if you notice, there has been an increase in autoimmune diseases. And it could be because of the things that you just mentioned. We have all these triggers going around, and we're not really paying attention to it because we just know we feel bad, but we like the room smelling great.
Yeah, absolutely. And, and also, patients will come to me and say, I can't get off of sugar and carbs, and gluten and dairy, they're my favorite things, because I feel so miserable that that's my only happiness in the day, and I don't blame them. They're not wrong. They're just trying to solve a problem. They're drinking caffeine. They're trying to, they're drinking caffeine with high fructose corn syrup because it gives them a little bit of a buzz for 30 minutes so they can function, and then they crash, right?
Right.
So, I mean, there's a lot of shame in feeling terrible because it's like, well, what'd you do? What's wrong with you? Well, guess what? There's some genetic predispositions that you could have. Anybody who has autoimmune disease, someone else has it in their family, right?
Yes. I have 2 sisters that have lupus.
Yep. And who gave it to you guys? Your mom,
exactly.
Your grandmother. And 80% of autoimmune diseases are gone down the female side. So it's largely a female condition, although, that men have it, but it's just not quite as common. But it's really exhausting. And then when you go through puberty, when you go have a baby, and when you have menopause, those are times where you can have triggers.
Yes. When I turned 27, life before was perfect, fine, nothing happened. 26, all of a sudden I'm tired. And it's like, okay, this is a different type of tired, right? Different type of fatigue. It's just overwhelming. Like you've just been running 15 marathons back to back.
Right. Well, and the number one thing that they're finding that with COVID, COVID was a big trigger. I'll back up just a second. There's a immunologist named Dr. Vijdani, who's in LA. And Dr. Vijdani and Dr. Datis Karazian, where I did a lot of my functional medicine training, have been doing some studies on what is happening with, say, the spike protein or the COVID. And I'm not saying vaccines versus sicknesses. It's all lumped together in the same garbage pile for me. When you look at that protein structure of COVID and you look at how our tissues are in our bodies, there's this thing that's called molecular mimicry. So there are things in the protein amino acid sequence that makes up COVID that has similar repeating patterns to different amino acid sequences in our body, whether it be the thyroid gland or the joint tissues or the collagen or the mitochondria. And the number one thing that is similar from COVID to our own body is our own mitochondria. Now, our mitochondria lives in all of the cells of our body and it generates our energy.
Right.
So what if you have autoimmunity towards your mitochondria? Holy cow. You're not great at making energy, that is for sure. So what are we going to do to calm that attack down of your immune system toward your own mitochondria so that you can feel better? That's why the real big fallacy on autoimmune disease is you don't have a joint problem, a thyroid problem, or a rheumatoid arthritis problem. You have an immune system problem.
Yeah.
Why? Why did it get triggered, though? What's the root cause? What's driving it? How can we calm it down? We can't make everybody perfect, but we can make it better. We can't make everybody go negative, and we can make the numbers look better. We can drive down the inflammation. We can find the triggers. We can start calming it down, right? If we know what we're doing. That's a tricky part of all of this, right? Is it's an immune system problem. And you had a trigger that was genetic, you have a genetic predisposition that's sitting there. I tell people, I said, it's kind of like you have a loaded gun sitting on your dresser for your whole life, and you don't know when it's going to go off.
It makes sense now, looking back, because you're right. Everything was going great, and then all of a sudden, it just slowly started happening, and there was nothing I could do. I slept all the time. When the sores came, that's when I knew something's wrong. I have canker sores under my tongue and on the roof of my mouth.
So are those still happening?
Yes. This is how I know I'm having a flare-up. I get sores in my mouth, I get sores in my nose, and I get a really bad headache.
Okay. So, the number one thing I would think about is I would think about this thing that's called secretory IgA. So you can test it on a lab, or you can just assume that it's low if you're getting sores in your nose and your mouth, in any of your mucous membranes. On all of your mucous membranes, in your mouth, in your nose, in your throat, in your lungs, and your intestinal lining, is this sort of thick mucousy goo. And it's a thickness that protects you from virus and bacteria infections or penetration or, getting in. It's a thickness that protects us from all the critters and creatures that are around. If you're highly stressed, if you're not getting sleep, that secretory IgA can get really thin. This is kind of like when you have a really stressful test or you go through a really stressful period in your time of your life, and then you finally get through the stress and then you get sick. That seems to be the trigger. So when you're going through the stressful period, that secretory IgA gets really, really thin. So now it's exposed to everything. You can get invaded by bacteria. You can get invaded by viruses. You can, just everything kind of gets exposed. Well, there's 3 different ways to increase your secretory IgA and thicken the walls and the mucous membranes of your body. One of them is vitamin A. That's number 1. So I put people on vitamin A. And we also, remember, vitamin A is a fat-soluble vitamin. How are they digesting fat? That's a question, right? To make sure they're digesting fat. I'll give them a liquid A that they can just drop straight into their mouth so that it'll get in the mouth. And then it'll absorb through the mouth, and then they swallow it and they can absorb it a little bit better versus like a capsule or a gel cap. Now, second thing is sleep. Third thing is lowering their cortisol if their cortisol is high all the time. And then, so that's going to look into how do we lower the cortisol? Do we support the adrenal glands? Do we support it with adaptogen herbs? Sure. Yeah, for sure. All of that. But also, is it the immune system just attacking that tissue? Is there a viral piece to this? Is there a bacterial piece to this? I don't know. Do you know? Have you ever had any of these stores check to see if is there a viral, a virus associated with it, or maybe just not? Maybe just your immune system attacking the mucus lining, right? That's something to kind of look at.
I just know that was one of the symptoms that came up when I was diagnosed. I had a little bit of everything.
And fatigue, and all of the things. Yeah.
Fatigue is like my best friend.
So then we go, hey, let's run a ton of blood work on you to really look at all the things. How's the D? How's the A? What's happening with your liver and your blood sugar? And what does your CBC look like as far as how are your white cells? Is that high? Is that low? Sometimes autoimmunity, people will come in with white cells that are really, really low. And that's part of it's a hallmark of chronic autoimmunity. And so then you're your immune system has just been attacking and attacking and attacking and attacking your own self. Kind of worn out. So what do we need to do? Sometimes I give people turkey tail mushrooms, and that will increase the white cells. So we're going to pick apart and we're going to fix what we find. And that's the tricky part about all this, right? It's I'm going to get people off of gluten and dairy 100%. I'm going to put them on vitamin D, yes. Sometimes I'll just put them on a vitamin A, D, E, K together because who doesn't need all those vitamins? Let's get it done. And then I'm going to say, what else do we have? What does the lab work look like? I'll look at this marker in blood work that's called homocysteine. I don't know if you've ever heard of that marker before.
No.
So homocysteine is a really interesting marker. When you eat protein, it breaks down into amino acids, and the amino acids break down into homocysteine. And then from homocysteine, there's a couple other processes that happen, and then it all falls into glutathione. Glutathione is an amazing thing for our body. It's an antioxidant. We want it. It's helpful. It helps to calm your immune system down, helps you recover from disease. Yay. But some people, I'll check their homocysteine, and their homocysteine is really high. That tells me that they don't pull B12 and folate out of their food very well. This is the people that talk about methylation. They talk about MTHFR. They talk about inability to kind of detox things through their liver. Well, is that a problem for you? I don't know. Let's look at that number. If that number is normal, we're not jumping down that rabbit hole. If that number is really high and you're not doing that well, I'm going to say, hey, I'm going to put you on some B12 and some folate so that you can process this homocysteine thing, which is kind of inflammatory when it gets too high, and help you make more glutathione. And glutathione is one of these really interesting supplements that's a very, very strong immune system modulator. It kind of takes the immune system and it makes it chill. It just makes it calm down. I will put people on glutathione, and I'll put people on vitamin D. Those are my number 1 and number 2 favorite supplements in the whole world. They're the things that make the most progress with autoimmunity and as far as calming things down. And then, of course, sleep, supportive environment, making sure they're not living with someone who's a jerk, trying to get them out of the stressful situation, trying to get them to eat a little bit better. It's all the things, right? But it's vitamin D and glutathione are really, really big.
Before we leave, I would like to close with a special portion of the show I call Healing Heartbeat. This is where we allow ourselves to wallow in sorrow. Give yourself 3 minutes to laugh, cry, scream, cuss, or just sit in silence. Whatever you need to do to feel it, do it. Let the depression in for only 3 minutes. Once you reach 3 minutes, compartmentalize it and get back to living. This is a rinse and repeat behavior. You cannot let depression take over, because when it does, it will not let go. When someone passes away, They have the day they were born and the day they passed away. There is a dash in the middle. It's not a long line. It's a short dash. That dash represents your life. Go live in spite of having a chronic illness. Don't let your condition stop you. This is the end of part 1, Empowering Wellness, the functional medicine approach to chronic illness with Dr. Darla Booth. Tune in next week as I continue my conversation with Dr. Booth. Until next time, remember, you have the strength, the heart, and the support to continue your journey. Be safe.